Welcome to Accessia Health's webinar series, Amplify Your Voice, Control Your Care. For today's presentation, Medicare Open Enrollment, Preparation and Navigation. This topic is so important, and so we are thrilled that you decided to join us today. I'm Amy Jackson, Case Management Specialist with Accessia Health, and your moderator for today. Before we get started, I would like to cover just a few housekeeping items. First, all lines will be muted throughout the duration of the webinar. However, we do welcome you to submit any questions during the event using the Q&A feature located on your screen. We will have time at the end of the presentation to answer your questions. For the convenience of some of our viewers and for those who are hearing impaired, closed captioning is available and has been turned on. This webinar is being recorded and will be available to you at accessiahealth.org. Also, you will see polls throughout this presentation, and we hope that you'll participate as they pop up on your screen. And lastly, we must review our disclaimer. Accessia Health webinars, events, and conferences are intended to provide information to the public. The views and opinions expressed by any speakers or other third parties are not necessarily those of Accessia Health. So now, without further ado, I am so very excited to introduce our speaker for today. Julia Willis has more than 11 years of government finance healthcare experience, including Medicare and the Affordable Care Act, with broad expertise supporting large scale customer service program delivery. She currently serves as a vice president for Maximus, leading the successful delivery of the Centers for Medicare and Medicaid Services contact center operations, which handles over 35 million customer inquiries annually. Her transformative leadership style, customer experience knowledge, and deep health expertise enable ongoing innovation and operational efficiency. She has an exceptional track record for delivering at the speed and scale required to execute high priority initiatives. This includes successfully managing a qualified customer service workforce of more than 13,000 employees at its peak. She serves on the Maximus Foundation Board of Directors and is a member of the Women Business Leaders of the U.S. Healthcare Industry Foundation. Ms. Willis holds a Bachelor of Science degree in Fashion Merchandising Management from the Fashion Institute of Technology and a Project Management Professional certification from the Project Management Institute. Welcome, Julia.
Thank you, Amy. Great to be here. All right. I am thrilled to be able to share some information and tips on the Medicare Open Enrollment period. First, we're going to start with a poll to see how knowledgeable you currently feel about Medicare Open Enrollment. We'll do the same poll again at the end to compare how the audience is feeling and after we've gone through this presentation. So if you wouldn't mind going ahead and answering the poll questions now. And we'll just pause here for a few moments to give everybody a chance to answer. All right, so it looks like we have a pretty mixed group here. Some feel like they are pretty knowledgeable, others are neutral, and then we have some disagrees and somewhat disagrees, but hopefully after our presentation today, those numbers will jump more into the agree and strongly agree. So let's go ahead and get started. All right, I'm going to cover the basics first, then go into some more in-depth information. The open enrollment period, sometimes called OEP, runs from October 15th through December 7th. During this time, people with Medicare can join, switch, or disenroll from plans. You can only make one selection or enrollment during OEP, and your coverage will begin on January 1st of 2023. During today's webinar, we'll discuss two types of plans that an individual with Medicare can join, switch to, or disenroll from during the OEP. There are prescription drug plans, also called Part D or PDP plans. Then there are also Medicare Advantage plans or MA plans. If they also have drug coverage, they are often called MA PDP plans. We'll dive deeper into both of these types of plans on the next few slides. We will not cover Medigap today, which is supplemental insurance that helps fill gaps in original Medicare and is sold by private companies, because the best time to buy a Medigap policy is during your 6-month Medigap open enrollment period when you first enroll to Medicare Part B. Prescription drug plans, like their names infer, cover the cost of your prescription drugs, and they often lower the cost of your prescriptions. If an individual enrolls into a prescription drug plan, he or she will still have Part A for hospital insurance and Part B for medical insurance. All plans must cover a wide range of prescription drugs that people with Medicare take, including most drugs in certain protected classes, like drugs to treat cancer or HIV. A plan's list of covered drugs is called a formulary, and each plan has its own formulary. Many plans also place drugs into tiers within their formularies. Drugs in each tier have a different cost. For example, drugs in a lower tier will generally cost less than drugs in a higher tier. A Medicare Advantage plan is another way to get your Part A and Part B coverage. Medicare Advantage plans can either include prescription drug coverage or not include it. These plans are not through Medicare. They are through private companies that have been approved by Medicare to provide these plans, and they must follow set rules by Medicare. If you're enrolled to one of these plans, you need to use providers that are in the plan's network, or you could face higher costs. There are yearly limits on out-of-pocket expenses, providing peace of mind about the maximum amount you could spend on healthcare in a given year. There are 4 common types of Medicare Advantage plans: PPOs, HMOs, private fee-for-service plans, and special needs plans. Now that we've talked through the types of plans, I'm going to highlight ways to best prepare for the upcoming open enrollment period. First, I wanted to share some exciting updates for the 2023 open enrollment period. Medicare premiums and deductible information was recently published, and for the most part, costs are going down. For those individuals paying a standard monthly Part B premium, the cost reduced by $520 down to $164.90. For those with Part B, the deductible also reduced $7 down to $226. New coverage options were added for certain individuals that are 36 months post kidney transplant and therefore no longer eligible for full Medicare coverage, to help assist with continuation of coverage for immunosuppressive drugs by paying a premium of $97.10 a month. For those with Part A, the inpatient hospital deductible did increase by $44 to $1,600 for 2023. It's also important to note that if an individual or couple has an adjusted gross income over a certain amount, which is $97,000 for an individual or $195,000 for a couple filing jointly, there is an income-related monthly adjustment amount on top of premiums for Part B coverage and Part D or prescription drug plan coverage. More information on these income-related monthly adjustment amounts are available on Medicare.gov. As part of the Inflation Reduction Act, there were recent changes to Medicare costs for Part D that will actually begin on January 1st, 2023. People with Part D coverage who take insulin will have their out-of-pocket costs capped at $35 for a month's supply of each covered insulin product. Also, a Part D deductible won't apply to covered insulin products. This is some great news for those individuals that have to use insulin. In addition, Part D covered vaccinations recommended by the Advisory Council on Immunization Practices, including the shingles vaccine and the tetanus, diphtheria, and whooping cough vaccines, will be available with no deductible and no cost sharing to those with Medicare prescription drug coverage. Starting later in the year, on July 1st of 2023, people with Part B who take insulin through a traditional pump covered under Medicare's durable equipment benefit won't have a deductible apply, and cost sharing will be capped at $35 for a month's supply of that insulin. Now that we've covered what's new, we'll get into the details on how to prepare for the upcoming open enrollment period. One of the best ways to get started is to sign up for a Medicare.gov account. This enables you to manage your account online and do things like make payments, reprint Medicare or prescription drug coverage cards, view your plan information, claims, and MSNs. The most important item that you should do with an online account is enter and save your prescription drug information. That way, when you want to compare plans, that information will already be in the system, allowing you to view and analyze available plans and costs that are actually tailored to your needs. Before you get ready to enroll, there are a few things that you should gather to make the most of your time. Your preferred pharmacy information, names of any prescription drugs, dosages, and how often you take them, your preferred physicians and/or facilities like hospitals. Now that you're ready to enroll, there are a few different ways that you can enroll. You can call 1-800-Medicare and they can help walk you through completing the enrollment process and reviewing all of your options. If you'd rather do it on your own, you can log into your Medicare.gov account to review and enroll in plans online. If you'd rather work directly with the plan, you can contact them and enroll directly online via a paper enrollment form if they offer that, or by calling the plan you want to join, depending on which methods the plan offers for enrollment. Now, sometimes people need assistance when they are enrolling into plans, no matter which method you use. So there are several ways to get help. You can call 1-800-Medicare for help with questions to complete an enrollment or with assistance while reviewing your options. There's also a vast library of resources and information available on Medicare.gov. You can also use the chat feature on Medicare.gov. But first, you'll want to log in before starting a chat so that you're able to get personalized help. The State Health Insurance Assistant Programs, also known as SHIPs, can provide local, in-depth, and objective insurance counseling to Medicare-eligible individuals, their families, and caregivers. 1-800-Medicare can provide you with information regarding your local SHIPs, or you can visit shiphelp.org for more information. Now we're going to bring up another poll. I am interested to see if any of you have used any of those resources mentioned on the prior slide, and you can select more than one option if you used multiple before. So I'll go ahead and pause for a moment to give everyone time to fill out the poll. All right, so it looks like quite a few people have been on Medicare.gov, which is great. Some of you have called 1-800-Medicare and used the state health insurance programs, or the SHIPs. No one that answered the poll has used the chat feature, so I encourage you all to give that feature a check and see how that might be helpful for you. All right, thank you. So there are some key things to keep in mind for open enrollment. You don't want to miss the open enrollment period because without a qualified reason for a special enrollment period, there's really no other time to enroll. So that period, again, is October 15th through December 7th. So make sure that you get enrolled for coverage by December 7th for coverage that starts January 1st. I'd also urge you to not wait until the last minute and start the process early so you have time to consider your options before making a decision. You don't want to wait till the last few days and then having to collect all your information together and either call or go online to enroll. It'll be a much smoother and quicker process if you're able to do all of that pre-work up front and know what your options are a few weeks ahead of time before maybe making a decision. Make sure to do that pre-work and collect your prescription, pharmacy, and preferred physician information to make the enrollment process quicker and easier. And really make sure you consider all your options and really what plan best fits your need before enrollment. Comparing plans is an important part of the process, even if your plan has not changed. Plan costs change from year to year, and what plans cover change from year to year. So really you'll want to look at, hey, what are my needs and what plan best fits my needs, even if your plan isn't changing, because there might be better coverage or lower cost coverage available to you through other plans. The other thing to note is there's a ton of advertising out there, and make sure to do your homework and figure out what plan works best for you from all of the options out there. And if by chance you feel that you may have been misled into joining a plan, you can contact 1-800-Medicare for some assistance. A few more tips to share. If you have a caregiver or a family member that assists you with your healthcare decisions, you can fill out an authorization form on Medicare.gov to allow Medicare to speak to that individual. That's really helpful to have in place if somebody is going to be enrolling you or helping you with the process, that authorization is on file already, so you don't have to worry about it. It's quick and easy to do with your Medicare.gov account. If you need help with costs, there are programs that might help pay for costs like premiums and prescription drugs. More information is available on those resources on Medicare.gov. And also, there's the Medicare New Handbook that was recently mailed out, and it includes a lot of key information, so be sure to review it. If you didn't receive one, you can also access one at Medicare.gov, or you can call 1-800-Medicare if you need to request a booklet. And finally, there are a lot of helpful resources out there to further assist you, which I've linked to on this presentation, and I believe we'll be sharing some of those links in the chat. There's video overviews of Medicare and all the choices available to you. There's details on Medicare.gov on what Medicare covers and what each part of Medicare covers as well. There are resources to get extra help with costs. There's also information on how to report Medicare fraud and abuse. And the State Health Insurance Assistance Programs, or shiphelp.org, is another great resource. Also, I wanted to be sure and mention that although Medicare usually will not call you, there are some specific situations where you can expect a call for follow-up reasons. If you send a letter to Medicare, you may receive a call in response. If you have an issue that was escalated, Medicare will let you know that you will receive a call back in regards to your escalated issue. Also, if your call gets disconnected, Medicare may call you back as well. There is also a new service being piloted for those new to Medicare, where Medicare will offer to call you back for an in-depth overview of Medicare the first time you call 1-800-Medicare after becoming eligible. The number that will always be on your caller ID for any of those calls directly from Medicare is 1-800-Medicare, which is also 1-800-633-4227. All right, now that we've had a chance to go through all of the information in the slide deck, I'm going to go ahead and open up another poll to try to gauge how knowledgeable you now feel about Medicare Open Enrollment now that I've shared all these details with you. So if you wouldn't mind going ahead and answering the poll question, I am knowledgeable about Medicare Open Enrollment. Your options are disagree, somewhat disagree, neutral, agree, and strongly agree. All right, so it looks like we definitely had some movement more into the agree and strongly agree buckets. So I'm glad the information I provided here was helpful. I know there might still be some information you have questions about. So that concludes my part of the presentation today, but we'll now go to the Q&A portion of today's session, and Amy will be here to help me with those questions, and I'll provide as many answers as I possibly can.
Thank you. Thank you so much, Julia. You provided some valuable information, and I'm sure it will help many. We do have a few questions. However, you can continue to submit questions through the chat about anything that might be on your mind about Medicare Open Enrollment. One of the questions we did have was, can you look for plans online like you can do for the ACA, or do you have to go to different companies' websites?
Yes, so you definitely can look at plans online. So if you sign up for a Medicare.gov account, you can also compare plans based on your individual situation, which is, knowing what your prescription drugs are, knowing what the dosage is, how often you take them, preferred physicians and facilities. But you can shop and compare all of that online on your Medicare.gov account. Starting on October 15th. So you won't be able to compare anything right now, but all of that will be available for you to compare and enroll into as of October 15th.
Thank you. Thank you, Julia. We also it's kind of a follow-up to that question. What is a good source to look for Medigap plans?
Yes, so I would also go to Medicare.gov for those Medigap plans. There are information and resources to help you compare those plans. Again, the best time to enroll in a Medigap plan is after you first become eligible for Part B. There's a 6-month period, which is kind of called your Medigap enrollment period. After that time, you can still enroll in Medigap plans. It just becomes a little more challenging. There might be some health requirements or an underwriting process for those plans.
Yes. Yeah, and I get a lot of questions during open enrollment. People, when open enrollment comes around, they think it's an open enrollment for Medigap plans, like it's included, as well as Medicare A and B. Can you just talk about a little bit about when you can enroll in Medicare A and B if you didn't enroll when you were first eligible?
Yes. So if you did not enroll when you were first eligible, it really depends on what your situation and why you didn't enroll when you were first eligible. That might have been that you still had working age insurance. If you were still working, you might have had some sort of retirement insurance. So there are a lot of different reasons. So unfortunately, there isn't a clear-cut answer to when you can enroll. But the most important thing to do is pre-plan. So when you know you're coming up to that 65 and eligibility for enrollment, Medicare will send you a lot of information. They'll ask you to sign up for a Medicare.gov account before you're even eligible, so you can start seeing all the information available to you, when you should enroll for what, and that will help you determine when you should actually enroll. And you can also use 1-800-Medicare as a resource. You can call them up. You say, hey, here's how old I am, here's what my situation is, and they'll recommend for you when you should come back and enroll. Because unfortunately, if you don't do the right steps at the right time, there can be costs and penalties that make it challenging. So definitely, even if you're like, I already have insurance when I'm 65, make sure that you actually give us a call at 1-800-Medicare, or you do some research online to find out when you need to sign up, even if you already have insurance.
Great, thank you. We also have a bit of a specific question, but the individual is asking their spouse is retiring in June, and they're asking if they will be able to, if that person will be able to compare plans online at that time since it's not open enrollment, and how far in advance does or can he enroll in Part B and D? So it's a twofold question.
Got it. Yes. So again, it depends on their specific situation, but yes, you will be able to compare plans online if you become eligible during a plan year. So the plan year has already started. You're in 2023. All of the plan information for 2023 will still be out there for somebody that has an initial enrollment period. So that's what we call, it's not open enrollment, it's your IEP initial enrollment period. So you'll still be able to compare plans, understand your costs. Now it will be tailored to the cost for the remainder of the planned year versus for a full year for somebody that's comparing plans for right now to start January 1st, because you'll already be within the year. But yes, all of that will still be available to you when you sign up for Medicare.gov and are eligible for Part B or Part D.
Great. So this question is asking Medicare Navigator, what is it? What is a Medicare Navigator?
I'm assuming they're referring to a ship, and a ship really is kind of like a outside third party. Like, they have no opinions in the process. They're not making any money from helping an individual figure out what the right plan might be for them in their specific situation. So they'll kind of spend some more in-depth time, sometimes in person at a local ship office, and walk you through, here's your situation, here are your options, here's what seems to best fit your options. 1-800-Medicare will never give you, they'll tell you what your options are, but 1-800-Medicare will never say, this is the plan I recommend for you. They'll give you all of the options and let you make the selection for what you feel best meets your needs. A ship might be able to more steer you in the right direction for a plan for your needs, instead of kind of being that neutral, hey, here are your plans, you make the decision. A ship might help steer you towards a plan based on your needs.
Yeah, so they act more in an educational role to make sure that
Yes,
they're helping the person meet their specific needs. So that's
definitely.
a great question. We have another question here. Is the Medicare birthday rule going to be in effect in 2023 for those who may want to change Medigap plans without underwriting?
That I do not know the answer to, but I can find a response for that, and we can provide it to you all, and you can share it once the webinar is shared.
Okay, great. Thank you. So the next question here says, for disability regarding end-stage renal disease and someone that has extremely high prescription costs, they're asking, should they be looking at Part D plans? Is the way the question is stated?
So I would look at all of your options. So when you compare plans for the next year, you can compare plans like we talked about, MA or Medicare Advantage plans that just replace your Part A and Part B. You can also look at Medicare Advantage plans that have prescription drug coverage, and then you can look at standalone prescription drug coverage. So it really depends on which costs you're trying to tackle. If your medical costs are something you're trying to tackle, you might want to more look towards an MA plan or an MA PDP plan if you're looking at bringing your medical costs and your prescription drug costs down, or if you're just concerned about prescription drug costs, then you'd look towards a PDP plan or a prescription drug plan, also called Part D. So many names.
Yes, yes, a lot of acronyms. Um, so this question is asking what items are covered under a Medicare Advantage plan? Does this mean I no longer have Medicare Part B coming out of my Social Security check?
So it all depends on your situation, but a Medicare Advantage plan covers the same things that Part A and Part B cover. So you would pay your premiums through the Medicare Advantage plan.
Okay. This question is asking, is it true that if you choose a Medicare Advantage plan that you can never switch back to a regular plan?
That is not true. So you can disenroll from a Medicare Advantage plan and go back to what they call traditional Medicare or Part A and Part B. Once if you've made the transition, you can go back, yes.
Okay, great. So I've had a lot of questions regarding the new out-of-pocket costs with Medicare Part D. Can you talk about the changes in the coming years regarding that?
Are you talking in regards to some of the changes that are not happening this year, which I covered
Right.
in the presentation? Got it.
Yeah, because because that information is being released right now regarding Medicare, some people may feel like it applies now. So wanted you to talk a little bit about when those things will be taking effect in terms of next year and the official 2025. So people are still aware that Medicare Part D does not have an out-of-pocket maximum right now.
Yes. So there are a lot of changes coming. And so some of those changes don't occur until 2023, or I'm sorry, 2024 or 2025. So let me make sure I've got the
I
right information. Oh, sorry.
Oh,
Did you?
no, no, no. I was gonna
Yeah.
say, I believe, well, I know that, and I believe in 2024, it's gonna cap at the catastrophic level, and then I think that official in 2025, that $2,000 out-of-pocket max is supposed to go into place. But keeping our viewers focused on the current year, just making sure that they are aware that there's no out-of-pocket yet applying to their enrollment choices for 2023 for Part D.
Got it. So for Part D, that is correct. Yep.
Thank you, Julia. What if I have another question here? What if I enroll in a plan during open enrollment and I'm not happy with that plan? Can I change?
So unfortunately, you can only change plans during the open enrollment period, which is one of the reasons it's so important to make sure that you look at your options and that you pick the plan that best fits your options. There is a period that runs after OEP where you can also change your MA plan that I believe runs through February. And so you can make adjustments then. But otherwise, there are special circumstances. For example, if you feel like you've been misled into a plan and we're told it covers something that it actually doesn't cover, then you can call 1-800-Medicare and you can submit a complaint and you might get a special enrollment period to enroll in a different plan, depending on what the situation is and the decision that's made by CMS.
Yes, and I believe that Medicare Advantage open enrollment period is I think it's from January 1st to March 31st. But in order to utilize that Medicare Advantage open enrollment period, you have to be enrolled in a Medicare Advantage plan on January 1st. But for someone that chooses a Medicare Advantage plan on January 1st, they enroll in the plan, but they're not, it's mid-January or February, and they're not happy. If you're in that Medicare Advantage plan, you'll have that option to revert back to, like you said, the traditional Medicare and choose either a Part D or a different Medicare Advantage plan. So
Yes.
that would be helpful. This question, why can't I find my specialty medication in the Medicare plan finder?
So mostly all medications are in the plan finder tool. Occasionally, there are medications that might not be in that tool. My recommendation would be to call 1-800-Medicare and have assistance with entering that drug. It might be called by a different name. It might be called by its generic name. But they might be able to do some searches to help you figure out how to get it into your saved drugs in your account, and they can save it there as well.
Great. Yeah, and I know that some specialty medications, it depends on how they're administered, often will determine how they're covered too, and whether they're covered through prescription benefits. So some specialty medications are administered in a hospital setting, so there's
Yes.
different rules. So it's important to check and follow up with that. We have another question here. What if I enroll in a plan during open enrollment, but change my mind before the end of the open enrollment period? Can I get a different plan if it's still the open enrollment?
Yes. Yes, you
Thank
can.
you.
You can change your selection, but I'd recommend only doing it once because that can get very confusing. But yes, as long as it's during the open enrollment period and before December 7th.
Okay, great. This question says, what about enrolling directly with insurance providers? Do they offer anything different if you enroll through them instead of through, like Medicare.gov?
The plans that are offered through Medicare.gov should be very similar to the plans offered through the insurance companies, because you can look at them on Medicare.gov or you can look at them on the actual plan's website or by calling the plan.
Thank you. This question is asking, can you talk a little bit about the difference between traditional Medicare and an Advantage plan? This individual is not really sure what to do because it's a little confusing.
Yep, I can do that. So they call traditional Medicare is really Part A, and Part B is your kind of traditional Medicare. So there can be some coverage and cost differences. For example, for Part B under original Medicare, you usually pay 20% of the Medicare approved amount after you meet a deductible, which is called your coinsurance. But for Medicare Advantage, the out-of-pocket costs can vary. Plans may have lower or higher out-of-pocket costs for certain services. So that's kind of why it's important to compare plans to say, okay, these services are services I might have this year. Here's what I'd pay under Medicare. Here's what I'd pay under this specific Medicare Advantage plan. So if you have original Medicare and Part B, you'll pay a premium or monthly payment. And then if you join a Part D and still have original Medicare, you'll pay a separate payment for that premium for that Part D plan. And then for Medicare Advantage, you pay the monthly Part B premium, and may also have to pay the plan's premium, although some plans do have $0 premiums, and may help pay all or part of your Part B premium. There's no yearly limit on out-of-pocket costs for original Medicare and Part B, unless you have supplemental coverage like a Medigap policy. For Medicare Advantage, plans do have a yearly limit on what you may pay for out-of-pocket expenses for services that would fall under Medicare Part A and Part B. Then once you reach that limit, you'll pay nothing for services Part A and Part B cover for the rest of the year. So, you might kind of weigh that. Do I have a lot of medical procedures that I might have in a year that would be covered by the Medicare Advantage plan, and therefore my costs are capped? Under original or traditional Medicare, there's no yearly limit. And then Medigap policies only work with traditional Medicare and may help you pay some of those remaining out-of-pocket costs, like your 20% coinsurance, or work with coverage like from a former employer, a union, or Medicaid. For Medicare Advantage, you don't need and wouldn't buy a Medigap policy. Again, they might cover different things. Original Medicare does not cover things like eye exams, dental care, routine exams, while Medicare Advantage plans might also cover some additional services like vision, hearing, and dental services that might be important to you. Yep. So those are some of the main differences for original Medicare. You can also go to any hospital or doctor that takes Medicare anywhere in the US. And in most cases, you don't need a referral to see a specialist, but with Medicare Advantage, you can only use doctors and other providers who are in the plan's network and their service area. And you may need to get a referral to see a specialist.
Yes, that's very important. And considering which option to take, that's all vital information. This question says, can I pay Medicare directly for my Part B?
So you can, you cannot pay Medicare directly. You can pay your Part B premiums. So you cannot call 1-800-Medicare and pay directly, but you can pay your premiums online via Medicare.gov.
Thank you. This question says, and this is all of those letters with Medicare, so this is why it gets confusing, but this question says, is there a Plan C, and what is the difference?
Yes. There is so many things, right? So Medicare Part C is actually what a Medicare Advantage plan is called. So Part D, prescription drug coverage, Medicare Advantage plan can also be called Part C.
Yes. This question says, is asking, if you take a Medicare Advantage plan, you will have to pay that $164.90, of course, for 2023, if you're within the income, and no other cost, or is there a possible cost for the Medicare Advantage plan in addition to that $164.90 for Part B?
Yes, so there might be an additional cost for that Medicare Advantage plan. There are some zero cost plans or plans that even help with that Part B premium, but there also are plans that have additional costs depending on what type of coverage and benefits that plan offers. But you will be able to know what those costs are and compare them either when you call 1-800-Medicare to compare plans, or if you compare plans on your own on Medicare.gov, you'll see what those monthly premiums are. And you can also estimate what you would pay in a year. So there are some helpful ways to look at it depending on your situation.
Yes. Next question. If I want to switch to a Medicare Advantage plan, when can I cancel or discontinue my Medigap or Medicare Supplement plan?
So let me make sure I give you the right information on that. All right, so you can cancel your Medigap plan at any time by calling your insurance company. But keep in mind that if you cancel it, you may not be able to get it back, and you may not be able to get a different one without going through the underwriting process. So what you would want to do is find out, just make your decision, enroll in your Medicare Advantage plan. Then once you've made that decision, call your plan, confirm with them when you need to call and cancel. They may be able to put a termination date in for you when you call, or they might say you need to call back on this date to cancel the plan.
Yes, yeah, that's important because you want continued coverage. You don't want to
Yeah.
lapse in coverage. So you want to make sure when that Advantage plan, and you can call that private insurance company that you have your supplement with and request that end date. Usually you can say, I want my coverage to end on this day, which is usually going to be through the end of the month. But yes, that's definitely very important. This question, Julia, I love because I'm sure Medicare beneficiaries get inundated at this time of year, and getting all that information can be completely confusing. So I so understand this question from working with Medicare beneficiaries. Are the ads that you see on TV featuring celebrities like Jimmy Walker legitimate?
So those are plans that are offered, but the thing to keep in mind is, no insurance company makes any money unless people sign up for their plans, right? And so often some will spend a lot of money on advertising those plans. And while it may seem like a great idea, like let me go ahead and sign up for a plan, it looks like what I need based off of this commercial or the information I see. The most important thing to do is to do a plan compare of everything that's out there, which you can do on Medicare.gov, or you can do by calling 1-800-Medicare, because you might not be getting the best fit for you just going to that one plan and enrolling with that one plan. You'll really want to see what all your options are out there. Yes, there's a lot of advertisements. You're going to get bombarded. The commercials are all over the place. But I really would encourage you to know what all of your options are before making a decision, so that you're not spending too much or getting a plan that doesn't quite fit your needs.
Yes, definitely. And I do want to let our viewers know in the chat, we have kind of broken down just a brief overview of all the parts of Medicare. So you can just see a visual of that. So hopefully you'll find that helpful. We do have a question here. I only have Part A because I still have medical care through work. I have been in the hospital twice, but Part A has not covered any of the costs. However, my husband, who is in the same situation, had some hospital costs covered by Part A. Does Medicare coordinate benefits with your current plan at work?
They do, but they have to know about that plan. So it's very important that the easiest way is to call 1-800-Medicare, so they can get set up for secondary insurance, and then they know which plan is primary and which plan is secondary, so that when you get billed for something, it goes to your primary first, then it goes to your secondary, and then those things get paid. And if you ever feel that something should have been paid and hasn't been paid, you can review your claims online on Medicare.gov, or you can call 1-800-Medicare. They can walk you through each of your claims, explain how things were charged and what was covered and not covered each step of the way, to help you have that knowledge and determine if you need to take it any further from that point.
Yes, and you can visit Medicare.gov, which will explain to you, like if you have employer sponsored coverage, because it gets down to specifics, like how many employees are there, on whether
Yes.
Medicare pays first, and other situations. So with Medicare, as you can tell, as Julia stated several times, that there's a lot, usually not just a simple answer. It requires you to dig and get in there, which are why ship counselors are really important, because that's their role, is like, let's talk about all of this stuff. Um, so we do have another question here. The questions are just coming. I love it. If I enroll outside of my regular enrollment period and have to pay fees, I'm assuming penalties, do I have to pay the fees for a set period of time?
It depends on your penalties. I'm assuming that you're referring to late enrollment penalties. So for Part A, you'll have to pay the penalty for twice the amount of years that you didn't sign up. For a Part B late enrollment penalty, you'll have to pay an extra 10% for each year that you could have signed up for Part B, but you did not. And then for Part D, generally you won't have to pay a Part D penalty if you had credible drug coverage or if you qualify for extra help. But you'll pay an extra 1% for each month, so 12% a year. If you don't join a Medicare drug plan when you first get Medicare, or go 63 days or more without credible drug coverage. So again, not simple. Different parts of Medicare have different late enrollment penalties, but they are all available on one single page on medicare.gov. And it even walks you through how to calculate some of those late enrollment penalties, so you know what kind of penalties you might face if you were unable to or decide not to sign up when you're eligible.
Yes, definitely. Well, I don't think we have any more questions. Thank you, everyone. Those were all wonderful questions and helped clarify a lot of things and hopefully helped each other. Thank you again, Julia. The information you presented here today provides many with the tools that they need to navigate the Medicare open enrollment period. And securing and understanding health insurance is just a vital part of being able to control your care, and having that knowledge really amplifies your voice, which is what our webinar series is all about. Thank you all for being here today. We encourage you to complete the brief survey that you'll receive after this webinar. It helps us to ensure that we continue to provide helpful information and content. If you are not doing so already, follow us on social media at Accessia Health to learn more about other presentations and upcoming webinar series. Again, thank you so much for being here, and we look forward to your feedback. Have a great day.
Thank you.
Thank you, Julia.